Today I'm going to be covering a piece of legislation that's pending, that's been sponsored by several Republicans in Congress, that will help veterans be freed from Veterans Health Administration, choose where, when, and who provides their health care instead of being a perpetual hostage like they are right now. So I'm going to go over this, and I want to point out who's supporting it because it's really important to know, but the name of it is Veterans Health Care Freedom Act. That's Veterans Health Care Freedom Act. And what you can do is contact your congressional reps and tell them to vote for this Veterans Health Care Freedom Act, to co-sponsor Veterans Health Care Freedom Act, and to publicly advocate for, just like I am right now, Veterans Health Care Freedom Act. That's what you can do. It costs you nothing. So the representatives that are supporting this are U.S. Senators Marsha Blackburn, she's Republican in Tennessee; Tommy Tuberville, Republican Alabama; Roger Wicker, Republican Mississippi; Tim Sheehy, sorry if I'm butchering names, Republican Montana; and Ted Cruz, Republican Texas. So those are the primary people right there. I'm a huge fan of Senator Blackburn. I've come to know her work with military veterans. She's a tireless, relentless advocate for them for years now, supporting and pushing through legislation and policy and being a real voice for them in a way that I really don't see any other politician doing, quite frankly. The Democrats are completely against this legislation and any legislation that supports military veterans choosing where, when, and who provides their health care, because they need veterans to remain hostages of Veterans Health Administration so that the employment system that currently exists can continue on unchecked, even though the non-clinical staff and some of the clinical staff hate their jobs, hate veterans, and don't want to work there. So obviously they shouldn't. The AFGE union has been basically eviscerated as of March 2025 via executive order by President Trump, and I support this. Currently, it's all caught up in litigation. It's quite complex. I looked over the information today. I'm not quite sure where the litigation stands, but what I do know is that the majority of Veterans Health Administration employees are no longer in a collective bargaining agreement and having the dues money removed from their check to give to AFGE union. Believe it or not, I used to be a member of this union, and I worked at Veterans Health Administration about 10 years ago before I quit due to whistleblower retaliation. I wrote a book about that called Veterans Affairs Whistleblower Retaliation that covers Veterans Health Administration in depth, the whole organization, with a focus on VHA. You can find that on my website, vanessaLeck.com. Anyways, AFGE union their money is going to nothing but no Democratic candidates and Democratic affiliated stuff, from what I can tell, on open secrets. I have linked that information below this video. If you're watching this on YouTube, you can see it there. Okay, so the link is there. I also linked directly to the White House, the fact sheet, which will have more information that you or I would even want to know about this, on the March 2025 executive order that eviscerated AFGE union. Okay, so again, I support that. I just watched a video of a Democrat. I think he was from, I want to say Maine. Anyways, none of these Democrats support this legislation because, you know, they have these talking points about privatization, but at the end of the day, what they really care about is just making sure the people that are giving them money stay rich, making sure that the people who are giving them money stay employed, making sure that the people giving them money get what they want. They don't care if veterans are suffering or if they're dying or if they're being told off and hung up on the phone like I was yesterday, or if they're not getting their health care and possibly end up getting a horrible disease and dying. They don't care. Like, that is not their problem. Disgusted with our two parties. I want to see multiple political parties and so on and so forth. That doesn't exist, and our government's massively corrupted. It's just a fact. But I do want to give credit where credit is due, because I will vote for politicians that support public policy that will improve my quality of life, okay? And these are the politicians that are. Unfortunately, none of them are in the state of South Carolina, where I currently live, or North Carolina, where I previously lived, unfortunately. And that's really unfortunate. And there are just a minority of politicians, too, that choose to care about these issues. So some of the highlights of this that I'm going to read right here, and this is also linked directly below this video here on YouTube if you're watching on YouTube, are the following. So the Veterans Health Care Freedom Act would help improve veterans' access to health care by reducing the Department of Veterans Affairs' role in the community care referral process. Basically, community care, for those of you who don't know or don't understand, is basically where you can go outside Veterans Health Administration and get health care. As simple as that. Veterans Health Administration does everything they can to interfere with that. Their administrators and the people below them, a lot of admin staff, like secretarial type staff, they're called MSAs, medical support assistants typically. They will just sit on a physician referral, for example, that's been sent to them to go to the community outside of Veterans Health Administration for medical care for a veteran indefinitely. This is illegal, of course. There are federal access standards that I've memorized, and 20 days is when maximum for till the veteran's seen primary care, 28 days specialty care. Okay, they don't care. They're lawless. They violate the law. This is what they do. They do it for money. They're stealing tax money. This is their game. So by reducing their role in what I like to see is decentralizing the power of Veterans Health Administration, you prevent that game from being played any further on these veterans. Veterans Healthcare Freedom Act would empower veterans to directly schedule appointments online. I love that. And I guess offline as well, at non-VA medical facilities, which would remove the current unnecessary barriers and provide veterans with greater independence, autonomy to access the care they need. And then they basically are saying, Senator Tuberville is quoted as saying, our veterans should be able to see a doctor as quickly and easily as possible. I agree with that. That's common sense. And that's not what's happening right now. I've fought for months personally just to get a primary care appointment. And when I tried to get out of the system because they kept delaying and denying my access to health care, that also was denied. And then when I finally filed 50 million complaints about it, some of which were outside of the Veterans Health Administration because the VHA likes to cover everything up. That's when I started seeing movement. I started getting health care. But even then, because the health care that I need is outside of VHA, they've done everything they can to interfere and delay that as well. However, I have been on them literally every single business day and will continue to get what I need. But that's not sustainable for me, which is why I'm so into medical tourism and started my travel with Vanessa Leck, social media and all this and that. And my website, vanessaleck.com, is mostly about going outside the US because long term, this is not sustainable for me. I'm 40 years old. I'm not getting any younger. I can't fight at this level forever for basic healthcare access. And there's a lot of veterans. In fact, the majority, I looked at the demographics, continue to be elderly veterans that are, in my state, South Carolina, these veterans are 77 years old and up on average. How do you think they can fight this fight to just get health care? And so they're getting railroaded by Veterans Health Administration. Nationwide, the average age of a veteran is somewhere in their 60s to 70s for an actual user of Veterans Health Administration system. So you have a lot of people that are very vulnerable and easy to exploit, which is what's happening. Veterans Health Administration is committing healthcare fraud at a level that most people cannot imagine. That's what they're doing. And they do this by interfering with veterans' needed health care and stealing the tax money. Streamlining the VA community care program is a common sense way we can increase access to care and cut through red tape. Legislation to eliminate the community care referral process and make life easier for those who have served. This is another quote, and it says, veterans must have access to community health care facilities. This legislation gives them more choices for medical care and helps avoid long wait times at VA facilities, said Senator Wicker. Barriers to access and bureaucratic red tape have stood in the way when seeking medical care, said Senator Sheehy. All of this is accurate, 100%. This is accurate. Legislation that will increase healthcare options and make it easier for our veterans to seek the quality of care they deserve. Accurate. That's another quote that was coming from the same senator. America's veterans deserve access to quality health care and the freedom to make decisions involving their health without unnecessary government interference, said Senator Cruz. Absolutely accurate. The Veterans Healthcare Freedom Act gives back those choices, cutting through bureaucratic red tape and that often delays or denies access to life-saving care. And that is the issue right there, life-saving. If this passes along with the other piece of legislation I covered earlier today, the Veterans Access Act of 2025, then this will immediately solve a lot of problems for veterans, because we're talking about quality of life and we're talking about people's lives being saved. and not being ended by this organization that is so money grubbing. And that's what we're talking about. And it needs to happen. Some of the people that criticize this type of legislation, which are always Democrats, which is why I never worried. I spend more time fighting for healthcare than getting it. I'm paying out of pocket 100% for healthcare that the VHA should be covering. And I'm leaving the country to get healthcare because the situation's so out of control. So what we need to do is address the crisis, and the crisis is making sure people don't die any further and have their quality of life destroyed any further when they already have a hard enough life as it is. That's the issue. And this, the Veterans Health Care Freedom Act right here, and this, the Veterans Access Act of 2025, will immediately address these issues, immediately solve these issues. So that's what we need to do. In the meantime, we can address later our government corruption problem, which is out of control, and the fact that pharmaceutical companies, the industry as a whole, my understanding is the #1 donor to both Democrats and Republican politicians, which is why we are the only country in the world that does not cap prices of pharmaceuticals. And that's why they're so out of control in this country. That's why American insurance companies and pharmaceutical benefits managers and the AFGE union are all giving money to these politicians to get what they want. And the AFGE union, I'd like to remind you, is only donating to Democratic candidates according to Open Secrets. I've linked that to the description below this video. And that's why the Democrats are against this. That's why they're against this, and they're against this, and they don't care who dies. They just want to get paid. Okay, so Senators Kevin Cramer, Republican, North Dakota, and Mike Rounds, Republican, South Dakota, also co-sponsored this legislation, the Veterans Healthcare Freedom Act. It was introduced in the House by Representative Andy Biggs, Republican, Arizona. And I constantly mention saying it's Senator Marsha Blackburn of Republican of Tennessee's legislation. In fact, it's not. She co-sponsored it. She's supporting it. She's advocating for it. But she's publicly advocating for it. But she actually did not create it. But I think she does a lot of the time because of the fact that she supports veterans so much and does so much advocacy publicly for them for many years, more consistently than any of these other politicians I've seen so far. So some of the highlights I want to point out about the Veterans Healthcare Freedom Act are the following. Veterans have frequently reported challenges in obtaining referrals for community care. Accurate. I've dealt with the same thing. VA introduced extensive bureaucratic obstacles, discouraging veterans from seeking community care in favor of retaining them within the VA's direct care system. That's accurate. I've dealt with that too. The VHA, Veterans Health Administration, has created unnecessary delays and complexities in the referral process. Also accurate. I've personally dealt with this. In multiple states, by the way. The Veterans Healthcare Freedom Act would remove the VA from the referral process. Hallelujah and amen, this needs to happen. To allow veterans to seek care where it is most convenient. And this is a great starting point, but we need legislation where this can be anywhere in the world that this can happen. Because, you know, veterans like me, their long-term plans, some of us, not all of us, but some of us, is to eventually spend most of our time outside of the US. And for some of us, it's because, for me, it's because of issues like this with medical situation being so bad in the US. And so we really need to expand this to be global, and that's another video. The Veterans Healthcare Freedom Act would remove the VA from the referral process to allow veterans to seek care where it is most convenient. And further, these are the things that I fully support this legislation, to be clear, and want everyone else to as well. But I would like to see everything to be more aggressive because I know how bad it is in Veterans Health Administration. So the Veterans Healthcare Freedom Act would create a 3-year pilot program within the VA Center for Innovation, Care, and Payment to improve veterans' access to healthcare in the free market. So the only problem I have with this is I don't want it to be a 3-year pilot. I want it to be immediate. Veterans, a lot of them don't have 3 years. I don't have 3 years. Like, I'm already leaving the country for healthcare. Started last year. We don't have 3 years to wait around. Because 3 years is more time for Veterans Health Administration to sabotage things, not implement them. 3 years is more time for politicians to do the same thing. Require that the pilot program be carried out in at least 4 veteran integrated service networks. Improve access to free market healthcare by allowing veterans to access primary, specialty, and mental health care outside of their corresponding visit and at non-VA facilities. Require the VA to give veterans information about eligibility, cost sharing, treatments, and providers so that they can make informed decisions with respect to selection of primary and specialty care providers and other available treatments. This is a really big issue because they don't want Veterans Health Administration or the Democrats to allow military veterans to make informed decisions. It's a human trafficking organization in a lot of ways where they use the bodies of veterans to make money. Literally. That's what they're doing. They're like, we want to keep you here trapped indefinitely, the administrators of VHA, so that we can make money off you. We don't want you to know what's going on. We don't want you to have any rights. We don't care how miserable you are. We're probably going to kill you eventually. But as long as we make our money, we're good. That's the game they're playing. So informed decisions, even since I've dealt with community care, every single time I've dealt with them, including recently at Columbia, South Carolina, VA main facility, they have made a point to try to tell me what vendor is what they call it, that they're going to sign me. And I'm like, no, I want to know every option in my area and I'm going to choose. And they don't like that. Make the pilot program permanent nationwide 4 years after enactment of the Veterans Healthcare Freedom Act, and fund the pilot program using appropriations, which is money otherwise made available to the Veterans Health Administration. It's probably my favorite part because that would help decentralize power from Veterans Health Administration, empower military veterans, and get us to where we need to go, which is veterans no longer dying from medical neglect. All right, that's all I have for today. I wish you the best. Happy Thanksgiving. Tell your congressional reps to immediately vote, co-sponsor, and publicly advocate for Veterans Healthcare Freedom Act and the Veterans Access Act of 2025. Did a video on that. Check it out. And feel free to share this video. Happy Thanksgiving.